Hi, good morning.
Good morning, good morning. How are you?
Good, how are you?
Good.
My name's Taylor. I will be your nurse practitioner student today.
Pleasure to meet you.
Great, nice to meet you as well. So before we get started, if you wouldn't mind just verifying your name and your date of birth for me.
Yes, my first name is Sleiman, S-L-E-M-A-N.
Okay.
Last name is Hussein, H-U-S-S-A-I-N.
Great.
And my date of birth is May 19th, 1993.
Great, thank you so much for that, Simon. So tell me, Simon, what brings you in here today?
I've been having a weird feeling in my stomach area.
Weird feeling in your stomach area, okay. So tell me a little bit more. When would you say this started?
I want to say a few weeks back.
A few weeks back, okay. Now, is this something that's been gradual, or would you say it's something that just came on suddenly?
I would say it came on suddenly.
Okay, suddenly. Would you mind just pointing the area of your stomach that this pain occurs?
Yeah, a little bit like this area right here.
Okay, so about right here.
Correct.
Okay. When you experience this pain, do you notice that it radiates anywhere in particular? For example, your back, your jaw, your chest?
No, not really.
Okay. Can you do me a favor and can you describe this pain for me? And I'll give you a couple examples as well. It can be dull, aching, sharp, stabbing, burning.
Burning. Definitely burning.
Okay. Do you ever experience a sour or acidic taste with this pain?
Yes, I do. Yes, I do.
You do? Okay. Have you noticed that there's anything in particular that makes this pain worse?
Usually when I'm laying down.
When you're laying down?
Yeah.
Okay. Do you notice during physical activity or exertion it gets worse?
No, not really.
Okay. Now, is there anything that makes this pain better?
Usually when I sit up, I did recently go to Walgreens to buy Tums as well.
And how did that do?
The Tums were good. When it hurt sitting up and eating, the Tums helped a lot.
Okay. How often would you say that this pain is occurring?
I want to say a few times a week.
A few times a week. Does it happen more so during the day or at night?
Nighttime. Nighttime,
okay. And lastly, on a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain imaginable, okay, where would you rate this pain?
I would say around a 4.
Okay. I just have a couple other questions for you, Slayman, before we begin a physical exam, if that's okay.
Okay.
Do you notice any nausea and vomiting associated with this pain?
I do not.
Okay. Any difficulty or pain with swallowing?
No.
Okay. Any blood in your vomit or stools?
No.
All right. Fevers or chills?
No.
Okay. Any unexplained weight loss, loss of appetite?
No.
Okay. How about any shortness of breath, chest pain, palpitations when you're experiencing this pain? Okay.
No, not really.
Is there any coughing or wheezing going on?
No.
All right. If you don't mind, I would like to just do a quick physical examination on you.
Okay.
Okay,
all right.
Thank you.
Of course.
Okay, Slayman, I'm going to perform a focused physical examination. First, I'm going to assess your cardiovascular, then your respiratory symptoms, as well as your abdominal. Based on your presenting symptoms, okay? I'm going to first start off, if you're okay with it, with your cardiovascular.
Okay.
Just going to be listening to your heart. Okay. Heart rate and rhythm are regular. S1 and S2 are present without audible murmurs, rubs, or gallops. Wonderful. If you don't mind, I'm just going to take a peek at your radial pulses. Okay, radial pulses are +2 and equal bilaterally. I'm now going to assess the respiratory system and evaluate possible cause of the discomfort originating from your respiratory system. So first, I can see that your breathing is easy, it is unlabored, and it is symmetric. Chest expansion symmetric, no accessory muscle use. So if you don't mind, I'm just going to take a listen to your lungs.
Okay.
First, I'm going to listen anteriorly. So you can just take a deep breath for me. Good. Great. Now, if you don't mind, I'm just going to go towards the back and listen to your lungs that way.
Okay.
And again, just nice, slow, deep breaths. Good. Last one. Great. Breath sounds are clear to auscultation bilaterally without wheezes, rhonchi, or crackles. I'm now going to perform a focus assessment primarily in your abdomen, focusing on your epigastric based off of your associated symptoms.
Okay.
Okay. So I'm first going to inspect your abdomen for contour, symmetry, skin changes, scars, distension, masses, any of that sort. So if you don't mind, I'm just going to take a peek at your stomach.
Okay.
Okay. Great. No visible issues. So I'm now just going to take a quick listen.
Okay.
All 4 quadrants. Bowel sounds are normal active in all 4 quadrants. I'm just going to quickly percuss if you don't mind. Okay, predominantly tympanic percussion is noted without any unexpected dullness. Next, I'm just going to feel around at your stomach, so please just let me know if you feel any discomfort at all, okay?
Okay.
I'm now palpating 4 quadrants for tenderness, guarding, rigidity, or masses. Okay, the abdomen is soft and non-distended with mild epigastric tenderness, no guarding, no rigidity, no rebound tenderness, or palpable masses. Thank you very much, Slayman.
Of course.
Based on the patient's postprandial burning, epigastric and substernal discomfort associated with acid regurg worsening symptoms after trigger foods and when laying down, also absence of alarm symptoms, my leading diagnosis is gastroesophageal reflux disease and functional dyspepsia. Cardiac etiology is less likely based on the absence of exertional symptoms, radiation, dyspnea, diaphoresis, palpitations, and a normal focused cardiovascular exam. However, new or concerning chest pain would warrant an appropriate cardiac evaluation. As evident by this evaluation, there are no cardiac symptoms associated. With this particular patient, I would provide education regarding lifestyle modifications and discuss appropriate pharmacologic management and follow-up. This concludes my focus assessment. Thank you very much, Slayman Hussein. We'll be following up shortly.
Thank you so much.